Namaste viewers, welcome to Sri Anantha YouTube channel. Today we have Professor Dr. A.V. Srinivasan Swamiji with us, who will explain about the common causes for any diseases. Swamiji, can you please explain to us what are the common elements which will be the main reasons for the health problems?
Embodiments of love. Today I am going to share with you what could be the cause of any ailment. For any ailment, the basic cause is the stress. Generally, we see people who come up with any sort of ailment. If you check their blood pressure, it will always be either high or low. So why it so happens? Why there is a variation in blood pressure? It is only due to stress. Now, what could be the factor for stress? Any conversation between any person that leads to emotion, that emotion ultimately results into blood pressure. For instance, when we interact with our boss in the office, or with our subordinates, or any such reasons where any argument takes place that leads to emotion, means there is some variations in your blood pressure. And for this, the cause is first 5 sensory organs, which we have to keep under our control. When you perceive something, that only tempts you. When you hear something, that only tempts you. These are the main 2 factors for the stress. So these 2 factors, what it gives the adverse impact is, it starts with blood clot. All the emotions works on the nervous system, that is blood vessels. If I am emotional, then first either my blood will clot, or if otherwise, if I am emotional positively, then aneurysm. Only these 2 chances are there. So when I work negatively, when I perceive something in a negative sense, then I will have a stress over my blood vessel. So it starts clotting each cell. When it starts clotting each cell, where it clots, because always the stress goes to your head, your brain. So it clots only in your 8 lobes. So when it perceives through Broca and processing through vernicle, the first symptom is slurred speech. When a person unable to speak properly, then you can find the symptom, that variation in the blood level. At that point of time, if you see, the blood pressure will be highly raised or it may be low down. So the stress is the cause for any ailment. If this clot keeps on occurring in all the cells, then this will lead it to hypertension. When hypertension patient, if you see, they cannot control their mind, they cannot control their tongue. They need some kind of immunity boosting. For that, either they may go for some kind of candy, some kind of sweet, so that their blood pressure may be normal. And mostly this you can see to those patients who have low blood pressure. The normal range is 120/80, systolic should be 120 and diastolic should be 80. But in such patients who are very stressed, whose sugar level goes down, they will go for chocolates or coffee, and whose blood pressure is very high, then they need to take more of water because of dehydration. So this kind of symptoms you can see more. So in such cases, what would be the next impact of this blood pressure? So when entire place has been calcified in your head, then the peripheral nervous system will have the impact from the central nervous system. So immediately it will radiate through your subclavian artery, from the jugular artery, from the common carotid artery or internal artery. It will clot and it will spread up to your radial artery. In such cases, what will happen? If you see, you will have numbness in your hands. You cannot lift any paper. You cannot lift any tumbler. Everything will drop down, and finally it will lead into carpal tunnel syndrome in your peripheral system. When we talk about the neck region, there we have 7 cervical regions, C1 to C7, and all the disc, when it start drying up because of the stenosis, then that leads to disc compression. When disc compression takes place in C1, it will radiate up to C6. So in such cases, spondylitis cervical will be one of the ailment. When we have spondylitis cervical, when we say, the neck region will be very much stiff. It cannot move either of the side. With that, the pain will aggravate not only in the neck region, but it will have the impact over the occipital nerve, which is just adjacent to the medulla, and there may be a blur vision, and even it will radiate on the facial arteries, with which sluggish voice will be there, impairment of ears will also be there. So this kind of impact it will initially start with. Then from the cervical region, it will degenerate the entire spine, where you can find many kind of problems like diffuse or bulge or decompression or compression or dislocations in your spine region, and that ultimately leads into dysfunctions of your lumbar spine. So a person may unable to sit, and that may aggravate more of pain in the lower back, especially in the L4, L5, sacrum 1, and over a period of time the patient may have a complaint with RA factors, unable to walk, unable to recline also. Such factors may come up in the dorsal region. Similarly, in the thoracic region, if you see, when the calcification one by one, if it turns into stenosis and deep vein thrombosis in your spine regions up to your toe, then that may lead into brain stroke. For some cases, it may lead into brain stroke, and in some cases, it may lead into myopathy or cardiac arrest. So, such people should be very careful because of one stress. If that leads into brain stroke, either a person may be paralyzed on the right side or on the left side. So these two symptoms are always possible. After that, so many other impacts are there. If it is a cardiac arrest, then also you see all the 4 valves may be blocked. Initially it will start with how? Bad cholesterol. Aorta will not be affected too much. It will initially begin with bad cholesterol. In such cases, 2 parameters we have to always keep in check, that is triglycerides and low density lipoprotein. Triglycerides for those who have junk foods along with stress. When they have stress, they will go for junk foods only. They will go for more sweet items. So such people will always have the impact of bad cholesterols of high triglycerides. In case of diabetic patients, those who are gestational diabetes or type 1, type 2 or genetic diabetes, those people, they cannot stop the sweet items, sweet foods. So they will always their mind will demand for sweet food and they may consume more and more. That may also lead into low density lipoprotein. So low density lipoprotein will always lead into cardiac arrest. So a diabetic patient may also have a cardiac arrest. Initially, it will show the symptoms of bad cholesterol like triglycerides and low density lipoprotein. Over a period of time, that may lead into cardiac arrest because of the stenosis in the pulmonary arteries or the coronary arteries, or the right ventricles or the left ventricles. When such issues takes place, then people should avoid the stress. It is only because of the stress the diabetes also leads into dialysis, or the heart patient who has only a triglycerides leads into cardiac arrest, or even if it is on the brain calcification, that may lead into brain stroke. Now in the thoracic region, when you see when a person is having a cardiac arrest or the just a bad cholesterol, immediately that will have impact over his coronary artery, that will have the inadequate oxygen blood flow into the rest of the blood vessels. So when such things takes place, immediately the impact will be over the lungs. So the respiratory disorders will start. A person may have a hard breathing, cannot proper breathe, and they may unable to walk also, they cannot walk speed. So in such cases, their exercise activity and other activities will slow down. So when lungs are having a dysfunction, then that will have impact over the liver. So the indigestion problems takes place. After the lungs, the liver will have a disorder, then that will become dysfunctioned. So when liver disordered, the jaundice will be the first attack. After that, hepatitis A, B, C, these three symptoms will start. After a period of time, if you see when dysfunction, complete dysfunction or failure is their fatty liver have the complications, then that will lead into gastrointestinal disorders. So gastrointestinal disorders, if you see the symptoms, irritable bowel syndrome, this symptom will come, then constipation issues will start, then there will be some kind of hernia or kind of tumors, intestinal regions. With that, it will aggravate further to the pelvic region, where the PCOD problems or PCOS problems, this may be found in the ladies, and in gents the prostate problems, enlargement or contract, this kind of symptoms you can see. So for any kind of ailments, for all the thoracic region or the dorsal region, if you see, it is only because of stenosis, deep vein thrombosis, which takes place first in your brain, where there is a pressure because of hypertension. So you have to reduce the pressure in your blood vessels, so that in order to have a safe life and a happy life, first of all you eliminate all your stress from your mind. When you eliminate that, you can have a peaceful and a happy and a healthy life. So in further all these ailments we can discuss in detail one by one, how a patient is suffering because of stress and how many organs are getting affected, and finally how it leads into death. So these things, when we come to know exactly what is the cause and what are the symptoms, definitely we can eliminate all these parameters and lead a peaceful and a healthier life. Thank you one and all. God bless and stay blessed.